Hello, welcome back to the Neet Pg MCQ series. Here in this question, a 55-year-old man present for routine follow-up. He has a history of atrial fibrillation for the past 2 years. He is otherwise stable, but is concerned about his long-term risk of stroke. Physical examination is unremarkable. Which of the following is the drug of choice for long-term anticoagulation in this patient? Option A, heparin, option B, warfarin, option C, aspirin, and option D, clopidogrel. So here in this question, a 55-year-old man with atrial fibrillation and the risk of stroke. So basically in this question, what is they're asking, what is the drug of choice for long-term anticoagulants? So let's discuss about the option A, heparin. Heparin, it activates antithrombin 3 and which is inhibit thrombin and factor 10A. Heparin is a rapid onset and given IV or subcutaneously. Used in acute anticoagulants like in DVT, pulmonary embolism, or initial therapy in atrial fibrillation until warfarin kicks in. So that is also option A is not the correct answer because it's not suitable for long-term therapy, and there is a risk of heparin induced thrombocytopenia also, and frequent monitoring also needed. So option A is not the correct answer. Option B, warfarin. Warfarin is a vitamin K antagonist and which inhibit synthesis of factor 2, factor 7, factor 9 and factor 10. So its use is oral anticoagulant of choice. And oral anticoagulant of choice for long-term stroke prevention in atrial fibrillation. So why this is the best? Because it's effective in preventing thrombotic stroke in atrial fibrillation, and it's given in oral form, so convenient for long-term use also, but it's required monitoring also. But here the correct is warfarin. But let's discuss about the option C and option D also. Aspirin is as irreversible inhibit COX-1 inhibitor, that is decrease thromboxane A2, okay, and which decrease platelet aggregation. So it's a secondary prevention of MI, stroke, and in atherosclerosis it's used, but it's less effective than warfarin for stroke prevention in atrial fibrillation. And option D, clopidogrel. Clopidogrel is ADP receptor P12 Y12 inhibitor, which prevent platelet aggregation, and clopidogrel uses ACS stenting, stroke prevention in patient intolerant to aspirin. So it's ineffective for atrial fibrillation related cardioembolic stroke compared to warfarin. So here the correct answer is warfarin because it's a drug of choice for long-term anticoagulants in atrial fibrillation to prevent embolic stroke. So the correct answer is option B. Thank you for watching. Please subscribe this channel. Thank you.